Today, I wanted to very generally touch on the topic of trauma. Keep in mind, trauma is wide ranged and varied and is often classified as complex. Trauma, then, is multifaceted and thus layered as complicated. The events and or experiences, whether singular or prolonged in exposure, are relentless in recovering from and cover many situations and scenarios. Keeping that in mind, this discussion is very generalized. However, mental health services that target trauma focused interventions specific to individuals and circumstances are always encouraged for managing and processing triggers and symptoms in the professional and therapeutic setting. When a traumatic event is experienced, the effects will be different for each population, or what I like to call each sector of the traumatic event as a whole. So the bigger picture, the single event and or experience may be traumatic across a spectrum of populations and in varying ways, components, pieces of the event, if you will. As a result, reactions are thus differing. Same event, different experiences to the event. Recognizing this role is invaluable in assessing and addressing trauma. It's important to recognize common reactions to trauma: feeling stuck, isolated, and alone, self-isolation, as well as social isolation, feeling scared, afraid, and anxious, feelings of guilt, shame, self-blame, helplessness. Changes in sleeping patterns, eating patterns, and emotional disturbances may arise and cause both physical and mental challenges. External and environmental triggers such as times, places, symbols, tangible items, populations or situations, actual places, and internal triggers such as memories and thoughts may arise and cause both internal and external stressors such as panic attacks, uncontrollable, tearful affect that appear for no reason, anger, and so on. Nightmares, flashbacks, or distressing thoughts. Avoidant coping, such as downplaying the event in an effort to hide or mask real problem worry, symptoms, and reactions. It's worth mentioning here, avoidant coping is often subconsciously done and unintentional. These are just a few, and self-assessment is important in determining symptoms that are manageable on their own versus symptoms needing professional intervention and moving forward through the trauma. Because often people want to help, and because people experience compassion and empathy for others in general as an innate human nature, it's not uncommon that fear and worry can hinder the healing process we try to help others with. The fear and worry of not knowing what to say, not knowing what to do, not wanting to say or do the wrong thing, especially when it comes to sensitive and traumatic subject matter. And keeping those that you love and value close. Sometimes we avoid the conversation completely at the expense of the unknown, with general phrases that are nonetheless appreciated, but maybe just left at that, despite a desire to do more. I don't say this to discourage you. Any support you give anyone else will never hurt a person. But I say this to help change the conversation, to change the language from what's wrong with you, what's wrong with me, to what did you experience, what I experienced. To indicate something is wrong indicates a problem, not an experience. And to begin to heal, we have to process the experience. So I would like to share some tips on processing trauma, common reactions to trauma, being an active supporter to others, and of course, encouraging professional help as indicated if further needed. If you find yourself in the position to be a direct support person to someone who has experienced trauma, and of course you feel comfortable in doing so, or are automatically in the direct line of support, say as a family member, friend, colleague, and so on, sometimes we battle internally on how to help or what to do. Being present is enough, but when the need extends, here are a few things to consider that generally may be overlooked when in distress or panic mode, such as being put on the spot or involved in conversation with sensitive and traumatic subject matters of events experienced that a support person may benefit from hearing. In general, it's important to remember to be sensitive, meaning intentional and thought processed in the language you use. For example, shy away from or avoid altogether telling someone how they should or should not feel. Stray away from you statements such as you shouldn't feel this or you should feel this, because in all reality, they are experiencing the feelings they are having, And when we use the directive you, it, even if unintentionally or subconsciously done, it mistakenly alludes to something is wrong with me, or even self sabotaging or self blaming feelings of guilt for experiencing the feelings at all. We can't really say how someone should or should not feel because it's their experience, their body's response to trauma, their story. Stray away from questions, the why and what questions specifically. Why didn't this? Or what if you would have this, etc. It triggers the mind to all the endless scenarios that could have happened, but in all reality, didn't. Those hypothetical scenarios in reality are already cycling through the individual's mind. That cycle is endless and impractical outside of the professional and therapeutic setting in processing trauma presently, based upon evidence versus hypothetical residual pain experiences. I should have, could have, didn't, etc. By all means, it is important to listen to the individual's feelings regarding this, but not trying to conclude what should have happened or could have happened on behalf of the individual through our assumptions or cognitions. Remember, I'm speaking to you as a support to someone else, not as if you are a mental health professional where this may be explored deeper in treatment and recovery through a professional, therapeutic, trauma-focused process. Most importantly, listen. Really listen to the message the individual is conveying. This may include the verbal message and the visually cued message. In doing so, you are validating the experience, the associated emotions, the reactions, and the reality to their experience. While opinions, assumptions, and advice giving are avoided altogether and irrelevant when it comes to supporting a person experiencing trauma, a more realistic approach may include offering encouraging support, such as being a lifeline during a time of crisis, making your availability to the individual known that showing up and stepping up on your part goes without being said. So asking for help may become minimalized internally within that individual experiencing the trauma. Several people can be involved in a single event, the same single event, but each experience to the said single event will vary amongst each individual. So we can have one event and we can all experience it differently, obvious to our role in the event, for example. We cannot ever assume. Although the subject matter will be tough, it is important to always allow the conversation to be open. If someone comes to you wanting to talk and you are a support person to them, I always encourage the notion to be available and discourage disregarding or putting the conversation off. But if you are unable or uncomfortable in doing so, please encourage the individual and even help the individual to seek professional care. Remember, for many people, it takes extreme willpower, sometimes even defeat, sheer, raw, and real defeat as a last resort in opening out and coming to someone for help. So if someone does, and you are able, be the support, again, even in subtle ways. It is helping, and help find professional support when needed. Come together, be present, communicate. Be a part of the conversation, and if needed, change the conversation to how can I help? What do you need? What can I do for you? Look for realistic and rational solutions. Is there something I can do? And if there is, what is it? And do it. And if not, I have to find another solution, another way. Most importantly, how can I help? Direct questions result in what the individual truly needs rather than assuming. Always encourage professional help. Remember, grief and loss is ongoing. Recovery is ongoing. There is no endpoint to knowing where and when someone is healed. Sure, one can identify what they may look like, how that may look like for them, how they may know healing is indeed taking place. For example, I slept through the whole night for the first time since the traumatic event. I laughed today without feeling guilty. I got out of bed for the first time this week. But remembering the effects of the trauma are ongoing is important. It's a process. The good days may be there, but the bad days may be endless, and that is okay. Acknowledging that puts perspective to the reality, not in hiding or avoiding what one cannot. Putting space and time between the good and bad days is progress. Small steps are success steps. Value those as relevant and true. Those steps are real. Some facts to consider when helping ourselves and others. The human brain isn't fully developed until the upward ages of 25 plus years old. Ideas such as processing, understanding, responding may not even peak until after that age frame, and change is often created long thereafter in emotional connections and pathways. I often use this analogy in children. If it's hard for an adult to process and understand, consider the effects trauma intensely quantifies in our children. And in adults, if the trauma was experienced in early life but never treated, we can also see the lifelong effects well after the event or events have been experienced. There are specific therapeutic programs for persons experiencing trauma, such as trauma focused cognitive behavioral therapy. If you have experienced a traumatic event and are having heightened symptoms of the experience, or are a direct influence to someone who has or is, some things to remember and identify within yourself are as follows. First and foremost, you are not alone. Identifying your boundary and recognizing when you need help. What is your level of symptom tolerance to the distinction between your baseline, your normal reactions to trauma, and more severe symptoms, ones you cannot manage alone and need help in coping with? Secondly, you are valuable. You are worthy. You are enough. And I mean that always and forever. So I'm going to say that one more time. You are valuable. You are worthy. You are enough, always and forever. Finally, identify the need to recognize when a crisis is developing internally. What are you feeling? What will that look like for you? What are the triggers? How will you know the crisis is developing? Maybe your breathing changes. It becomes hitched or fast-paced. Physical signs such as a flushed face may be present. Tremors may be apparent in your hand, leg, body. Maybe you are experiencing worry that you are unable to control. What is it for you? Remember, it is different for each person. And what is your safety plan when you feel the crisis developing? What are your coping skills? Who can you reach out to for help? Make sure these are attainable and realistic, meaning they work to calm the crisis and revert back to your baseline emotional state. Create a plan and have it on hand in a safe place. Trauma affects many. Are you feeling like you want to help someone but don't know what to do or where to go for help? Start with asking directly, how can I help? That may be in being present, available, emotionally responsive. However, when the need is deeper and professional care is needed, and in speaking professionally here on finding a trauma-focused provider, a good place to start is the back of the insurance card, if the individual has insurance. Call the number to see what mental health services and providers they cover for you or your loved one in your area. With virtual care rapidly expanding, virtual options are available and also a valuable resource to save lives and indeed change lives. If you or someone you know finds oneself in an emergent and dire immediate emotional escalation situation that appears uncontrollable and unmanageable, please remember the following. 988 has been designated as the 3-digit dialing code available nationwide as the Suicide and Crisis Lifeline. Suicide and Crisis. It's a lifeline, a resource, help. Anyone experiencing emotional distress or suicidal crisis can call, text, or chat 988 and be connected to support. The Lifeline provides 24 hours a day, 7 days a week, free and confidential support for people in distress, prevention, and crisis resources for you or your loved one. Best practices for professionals in the United States. So what happens when a person calls 988? Those who call 988 will hear a greeting message while their call is being routed to a local crisis center within the Lifeline network, based on the caller's area code. Help is available. 988. It's free, confidential, and here for you. I hope this, in some small and meaningful way, is accommodating in general. In closing, I would like to ask you this. How can I help?